you don't have to want to be healthy to make small changes to make yourself healthy. You don't have to want to be a superstar fitness person to become extremely healthy. You just have to take better care of yourself. And the first line of defense we have is being a bit more active and really paying attention to not just if we're sitting, but the way that we're sitting, the way that we're standing, the way that we're walking, the way that we're bending or hinging. So the problem, it's really simple. Literally there's this downward force that is absorbed not just straight downward, but all around our body. Gravity is, every movement we make, there's gravity involved. Our daily movements have changed dramatically because of our daily activities and our hobbies and our activity. I already said activities. I'll say it again. Activities. Everything we do takes us inward. It takes our focal point and brings it even closer inward. Everything is on a screen now. If you practice this work, there will be a learning curve because it's valuable. And anything that's valuable requires some time to learn and understand. The more you learn it, the more you'll get out of it. And I promise that anybody that dedicates their time to learning foundation work and learning my work, learning all of the new stuff that I'm putting out there in the future, will get significantly stronger than they are, regardless of how strong they are. The human animal is much more resilient than any one of us believes we are. When we're tested, most of us will thrive and realize that, yes, in fact, we are extremely resilient people. And resilience is nothing more than confidence. The more you realize you're resilient, the more you realize you're confident, the better your entire life improves. And all of a sudden, just your posture improves, your mental energy improves, your interactions with people improve. And these are really important things in our culture because that's what we're lacking. You have to connect with your body. You have to teach your brain to understand what's happening within your body, both from a physical standpoint structurally and from a digestive standpoint nutritionally. When you start to become sensitive to your posture, you start to recognize the good and bad things that are happening in your body because of it. And what I teach people through exercises, through perspective, through principles, is how to feel, how to get in touch with that, and how to recognize both when they're doing something good and when they're doing something bad, and it becomes incredibly easy to remedy.
Hi, this is Dr. Mercola, and today we are just delighted to welcome back to our media studio Dr. Eric Goodman, who is an emerging pioneer superstar in the world of structural biomechanics that can help teach all of us to optimize our posture and decrease our likelihood of developing future pain and exercise injury and a whole variety of other things. I mean, this is an essential part of an exercise program. I'm just so delighted to have met him in the past, and I'm glad that we've had him on our interview before us because we show his video frequently, and it's always well received. So he's back here for an update. So thank you for coming back from California and joining us here in Chicago, and welcome.
It's an absolute pleasure. I really appreciate it. I appreciate the support you've given me. It's been really wonderful to be involved with you guys. So thank you very much. I appreciate it. And the first line of defense we have is being a bit more active and really paying attention to not just if we're sitting, but the way that we're sitting, the way that we're standing, the way that we're walking, the way that we're bending or hinging. I talk about hinging a lot. A lot of people talk about hinging a lot. I have a slightly different perspective on it. But yes, Dr. Vernikas's work is phenomenal. I think that she is just as on point as it gets in this arena.
And she's a NASA scientist who worked with the astronauts for decades and recently retired to teach what she'd learned while she was at NASA.
She's so much smarter than me. She's so much smarter. It's great because...
But she doesn't have the practical wisdom. Well, you have the practical wisdom, and the marriage and the synergy between your two work is going to be phenomenal.
It was really cool, the response we both gave each other when we realized what we were doing and realized that we had actually kind of been doing the same thing from two very different angles, and we met at the middle in a really nice place. I know that she has a very deep appreciation for my exercises, and I have a very, very deep appreciation for her science, because there's a woman standing behind a NASA stage telling me that what I'm doing is right. It's manipulating gravity to your benefit. Dr. Vernikas's work is all about gravity and its effects or its lack of effects on us while we're sitting. And my work is the manipulation of said gravity to benefit you while you're standing, while you're sitting, while you're laying, in every position you're in, using as many muscle chains as possible to support your body against that constant resistance of gravity, instead of allowing your joints to just kind of
So why don't you briefly describe what the problem is from your perspective? Because, I mean, this is really the problem that faces the majority of humanity, and at least industrialized humanity, because There's another posture expert, Esther Gokle, who has really marvelous pictures of ancient or non-industrialized cultures where they aren't exposed to the constant sitting like we are, and they have natural postures with no specific exercise problem. Or if you take pictures from or statues from ancient history, you can see this. So why don't you tell us what the industrialized problem is?
I will. Yeah. And first, I think Esther's work is phenomenal. I haven't been very vocal about her work because I'm very new to this game. She's been established longer than I have, and I have a real respect for that. And I think everything she's saying is dead on. I take a different approach, but it is not to say that hers would not be extremely complementary to mine. It would. It will make people feel better, absolutely. Yeah. So the problem, it's really simple. Literally, there's this downward force that is absorbed not just straight downward, but all around our body. Gravity is, every movement we make, there's gravity involved. Our daily movements have changed dramatically because of our daily activities and our hobbies and our activity. I already said activities. I'll say it again. Activities. Everything we do takes us inward. It takes our focal point and brings it even closer inward. Everything is on a screen now. Everything is directly in front of us. And then our head, I used to really preach, and I still do, I preach this hip flexor distance. The rib cage has to be a certain height above the pelvis, or else you're really putting a lot of pressure into your lower spine. What I'm finding actually is that is important, but the real plague that we have is this.
Extending the head forward.
It's this
Which is so easy to do.
It's this shortening of the suboccipital muscles in the back of the neck.
Okay.
Changing every single movement from that below, and this is the top. When that change happens, this lollipop head of ours just takes this stick spine of ours and puts weight in all the wrong places. And it creates a pattern that breaks us down. I want to go back to the high intensity exercise stuff. When you're doing this, it's high intensity. For some people, it
may not seem like it though, because it's just a simple isometric pose.
Yeah, it's a very simple exercise, but what that simple exercise is doing is the key. It's anchoring the pelvis from below using some very powerful muscles, the adductor muscles, the glutes, the hamstrings, the posterior tibialis, the anterior tibialis, the arch muscles, the hip flexors, the quads. I mean, you're lining up so many muscles into a given movement. Then you go above the pelvis, and you're decompressing the spine. So you have the anchoring muscles pulling down, the decompressing muscles pulling up, and you're creating this tug-of-war among muscle chains while protecting the spine, bracing the abdomen, bracing the organs, elevating and expanding the rib cage so that you can take a full breath. Because a lot of people forget that your lungs are in your rib cage. What I say, just for my own personal work, is I'm going to give you a template from which I know it is safe for you to explore. This is your template, though. This is your strong structural position that is always like your base. You're always going back to base. That base is integrating the posterior chain, integrating the adductors into the base of the pelvis, all these little ab muscles up here, all the hip flexors, all the lower back muscles, all the really important neck muscles that I talk about a lot, the SCM, and keeping the back of the neck nice and long instead of short like that. All of these things go into that template. But from there you can explore and you get to learn about your body. You get to understand what's happening, and you get to see very profound results if you continue.
So we're in no disagreement with Dr. Vernikos's work, whose book is Sitting Kills. And there's emerging research now, which really sort of catalyzed my involvement and interest and exploration to this area, because it was sort of a variation of the question I asked you earlier. You know, what about these people who are incredibly fit, Olympic athletes, or just some of the best fit people on the planet, and they're still at risk if the majority of their day they're sitting and they're not addressing these postural changes. So that is a risk that almost everyone watching this video has. So it's sort of pervasive to the industrialized nations. So can you provide us, the typical person watching this, viewer, as to what some of the basic simple things that we can do to stop that negative decline that this microgravity scenario, where we're interacting with gravity adversely and it's actually destroying our structure rather than using the gravity to build our structure up?
Yes. 3 principles. And I'm not going to go extremely deep into these principles because that's something that I'm going to be doing for the next couple of years. It's what I do in my certifications. It's something that I can't teach in 20 minutes. The first tip is anchoring. When somebody is standing on the ground, first, get your shoes off as often as you can, as long as it's like a safe environment around you. You don't want to step on glass or anything, but if there's grass, if there's rocks, whatever, just get your shoes off, walk like a human being for a little while. When you have your shoes off, think literally of gravity pushing down on you. And push back. Push your feet into the ground. And remember that your feet are not very different than your hands. Mm-hmm. This is very close to a foot. Imagine if your palm had no strength. What would happen to your forearm? What would happen to your shoulder? What would happen to your chest? What would happen to your neck? It would all weaken if you didn't have grip strength. Our feet, in most cases, have no grip strength. We've got to work on that. That's tip one. You've got to get your feet to act like feet. They're not just dead things you smack on the ground and in these little comfortable shoes that don't allow you to feel the forces of gravity that are being put on you or the force that you're putting on the ground. We've got to be increased sensitivity there. So that's number one. In the certification, I go tremendously deeper into each of these principles to the point of understanding the anatomy, understanding it all. But for now, gravity's pushing back, pushing down. Seriously, push back. Stand as big, as broad, and as tall as you can. The next thing is decompression.
And based on Dr. Vernikos's work, that really it seems simple principle, but it really is quite profound because she studied the astronauts for 30 years, and anyone knows that when the astronauts go into space, they have microgravity, and because of that, they suffer serious consequences, and they have to do these exercises to counteract it. But it's this interaction with gravity that really is responsible for our health, and most of us are not. We don't understand that. We're not applying these principles. But if you can instead of it destroying your health, you can actually use it to improve your health.
Manipulate gravity to your benefit.
Yes,
it's so simple. And Dr. Vernica said, which is one of my favorite lines, the founder is the answer to her research. So, tip one: grab the ground with your feet. This might not look good on the interview, but so be it. Grab. Get your arch to work. Get your toes to work. Get your ankle to work. That all has to be strong and push back against gravity. The next is decompression from the pelvis up. And again, I'm not going to go really deep into the anatomy because this isn't the setting for it. It's a lot. This is a new idea and it is a lot. But basic principle, rib cage lifts, expands, and doesn't unhinge. Your rib cage isn't sticking out here. That's not what we want because that ends up actually collapsing the back of your spine into hyperextension. You're actively lifting the rib cage up, engaging the SCM muscles, and breathing into your rib cage while tightening the belly. So as you exhale, you're not letting your belly and torso sag. You're staying big. You're staying tall. That's decompression, very simply put. So when you're breathing, breathe big. The other one is integration, and that's my exercises. The exercises integrate muscular chains. If you integrate muscular chains in exercises like the founder and the woodpecker and a lot of the other ones that I teach, especially in my version 2 work, you're going to be a very happy person.
And what's a typical time where someone would apply this before they start to notice a difference? What's the range of time?
A week or two. You should notice differences. And within 3 weeks, you should notice profound differences. And you should be doing these things daily. 5, 10, 20 minutes a day. The postural exercises are probably the most valuable thing a person can do for their health. Truly. Other than sleeping well. And quite frankly, maybe more important than sleeping well in our modern
Well,
times.
It connects. If your posture is good,
you're going
to be in the right posture when you're sleeping too, which will facilitate the different levels of sleep. One of the principles that I was negligent of, and I really have adopted more, is the principle of recovery. When you do engage in these exercises, either weight training or high-intensity exercises, if you fail to integrate recovery into your program, you will get worse. You have to allow your body time to recover. So because these postural exercises are suggesting that we do on a regular basis 5 times for 5 minutes every day, the concept of recovery is crucial here because the intensity is less, so we don't require this recovery.
It's active recovery. You're recovering in these exercises. And granted, if you need to take a break, take a break. If all of a sudden you're,
always listen to your body.
If you're burning out, if you're exhausted, you got to take a break. But you're not taking yourself to failure. You're not taking yourself to this point of breaking down these little microfibrils in your muscles. You're not doing that. You're not bringing so much lactic acid into it that it actually burns and destroys some tissue in the area and have to recover from that. You're simply repatterning and repeating a better pattern. You're not trying to break an old pattern. You're just repeating a better one and eventually getting there. Most important is going to be postural exercises. You have to support your frame. You have to. Or else if you go and do the high intensity exercises, you're going to hurt yourself or you're not going to get nearly as much out of it. When people say pull your shoulder blades down to your back pocket, I know at least half your audience has heard that once or twice. Don't do that. Don't do that. Just don't do that, because what you're doing is you're taking a compressed spine and you're compressing it. You're pushing harder with gravity. You're assisting gravity. You're going along with it. Push the other way. Don't shrug your shoulders up. Push your shoulders out. Think of my hands in a little V, like a 45-degree angle. Get wide. Get broad. And then pull your chin back. That's posture. And then when you're relaxed from this posture, this is how you train it, is you go far in that direction. When you relax from it, just relax a little bit. Don't collapse out of it.
So why don't we take it a next step further, because when I interviewed Dr. Vernikos, one of her remedies, and this was prior to me introducing you to her, was to stand up every 10 minutes. And that literally performed miracles in many people that you recommend.
And it will, absolutely. Yeah.
Because you're interacting with gravity. But as we discussed this earlier, you had mentioned that if you're standing up incorrectly, interacting with gravity less than ideally, that you're not going to get the full benefits you can. So,
no, you're not.
So why don't you give us your recommendation?
Really simple. So first off, I love the idea of every 10 minutes stand up. Sure, if you need that regimen, set an alarm.
You can set a time, right?
Yeah, I get it.
Because it's so easy to get engaged and focused and concentrated. And it's an hour before you has gone by before you realize you forgot to do it. Right
now, it's actually interesting because I'm actually now having the experience of sitting at a desk much more often because I'm writing a second book. And while writing this, I'm spending so much more time than I've ever spent sitting at a computer. And I actually just got a treadmill desk. So that makes it a lot cooler. They sent over a treadmill desk that I've actually been really enjoying. So that's pretty cool. But I understand now why people need that regimen, why they need to be reminded every 10 minutes, because you get lost in your work and you're just, all of a sudden, you're not paying attention and you're here.
Right.
You're over your keyboard, you're just
and your chin is way out.
Yeah, you're in such a weird posture. You're just slowly curling over.
Right, the natural tendency the human body has when you're not paying attention. So, which will get you sick invariably.
Most important thing to do before you stand up is pay attention to where your chin is. Because where it's going to be is here. Before you stand up, you got to put it back. Put it back over the shoulders. Press your heels into the ground. Reach your hands forward. So watch as I do this. My hands are going to reach forward, and you'll see that my torso follows them. And then my torso actually kind of comes over my hips. And then I just reach up, and it just takes me up.
Which is like a mini founder.
It's a mini founder. Your chest remains high, your chin remains back, the torso is doing the movement.
You're leading with your torso.
Yes. The arms are taking just counterbalance. The arms are allowing you to stay really upright in your torso. As they come forward, I can lift my shoulders a little bit higher, and then as I lift from here and simply press my heels into the ground, it's just counterbalance.
And would you recommend, for those of us who are a little bit obsessive compulsive and seeking to obtain the benefits of interacting with gravity on a regular basis, would you recommend just doing that once or doing it a few times or any
all over? Yeah, do it 5 or 10 times during that 10-minute period. So this is the repetitive exercise.
Okay.
It's literally, I'll show you how to do it into a very simple founder too.
Okay.
First, you're going to be here.
Get the chin back.
Doing this thing. Get the chin back. And watch what happens when my chin goes back. It's not just this. I'm not just tucking my chin down, doing a double neck, double chin. I'm lifting my torso. My sternum
comes up.
Comes up every time I push my chin back. That's really important because that's what's engaging your lower back muscles and lengthening your hip flexors. Okay? So the sternum's up. The arms lift forward with the sternum up. And you just stand up. And if you want to go into a founder, just bring your arms behind you, expand your chest, and turn your thumbs out. And all of a sudden, I'm in a founder. Now you're using that posterior chain.
How long do you hold that
20, 30 seconds.
Okay.
It's 10 seconds. Whatever. I mean, really.
Would you recommend doing that a few times, standing up and down?
So the regimen of it would be 5 to 10 of those for 10 to 30 seconds apiece.
Okay.
Okay? And you should feel muscular tension along the lower back and a slight tension in the hamstrings. That's when you know you're doing it correctly. You should also feel like your chest is being pulled by your thumbs turning away from each other.
And for the average person who was convinced and started to apply this in their regimen, their daily regimen, what percentage do you think would notice benefit for those who are suffering from some type of back pain?
If they do it properly, all of them, or nearly, I can't say all of them, most of them.
Most all of them.
Yeah.
You've evolved it now into version 2, so can you highlight some of the things you've learned in the last 6 months and that you've incorporated into the newest version?
I would love to. The first thing that happened with version 2 is I recognized a few very small changes that needed to be made to version 1. And I made those changes. Those will be available pretty soon. That's what people learn in my certification, is they learn those first basic changes, and then they also learn a few things, one being this thing called tracing. It's one of the coolest things I've ever seen. It fixes shoulders, it fixes pelvises. What a lot of people do when they try to fix a shoulder, they try to fix a hip, is they take a broken hip or an imbalanced hip or an imbalanced shoulder and they push into it with exercises for the posterior capsule of the shoulder, the sits muscles, the supraspinatus, infraspinatus, teres, and there's one more in there.
Subscapularis.
Subscapularis. There you go. And they work these muscles, but they're not taking into account the fact that those muscles are connected to much bigger muscles that have much more say in how the shoulder works, much more. The lat has tremendous influence over the shoulder, as does the pec, as does the levator scap. Lots of stuff in there, as does the serratus anterior for that matter. So tracing is a biggie. I've been working on this one problem for a long time, and it became very clear to me what was happening about 6 months ago. And over the past 6 months, I've been working very heavily in diastasis recti. I've had a lot of people come to me in the past couple of years, a lot of women that have had babies, a lot of men that have had desk jobs for way too long that have this problem in their abdomen in which the linea alba, the connective tissue within the abdomen, just kind of separates a little bit. And their abs, instead of contracting linearly, like this, they start arcing a little bit, and they get this little 2 or 3 or 4 finger wide gap in their belly. Then what it ends up doing is actually really, really important, because diastasis recti is not the problem. The problem is that when your abdomen doesn't contract properly and stabilize itself properly, your pelvis can't stabilize itself properly because it changes all of the balance around here. And that hip tracing work is one of the really big things that I do for diastasis recti. And there's also an exercise called an 8-point plank, which is the exercise I am probably most excited to introduce with the new stuff. Because what I did for the posterior chain, I've now done for the anterior chain. You can only integrate the front of the body when it's in its right position, and those muscles within those integrated chains are within their best possible length. Not too short, not too long. So they can cooperate with the muscles around them in their chain. That then facilitates the exact same thing happening on the posterior chain. So by integrating the anterior chain, you're getting more out of integrating the posterior chain, and then it becomes vice versa. Once you learn to do the front, every time you do the back, you can do more for the front. It's this really cool, almost exponential benefit that I'm starting to get with these exercises now, and it's increased my library of exercises tremendously. In the past year, I've probably put together about 40 or 50 new exercises. Of those, about 15 are going to make it into version 2.
I'd just beyond delighted that you have had an opportunity to come out here and share with us and give us your updates. And for those of you who are intrigued by your work and interested in applying it, there are certainly DVDs and books that you have, but the ultimate, of course, is the certification training that you have, which is in Boulder. Thanks so much for watching. Remember, hit the like and subscribe button so you can get more videos that can help you and your family take control of your health.